special tests that are in your chapter, what is it, 19? Is it 19, Chris?
Sure.
Okay, so first one that you would have read about is called an alignment test. So normally you'd have them standing, but since Chris is just sitting here, we'll do it sitting. So alignment test is going to check to see if you're getting external rotation, this is external rotation, or internal rotation from your tibia or your hip. So at this point we're going to assess whether it's coming from the tibia. So the way that they do that is that if you're externally rotated, I would see where the alignment of your tibial tuberosity is. So I'd mark where your tibial tuberosity is and see if it's facing straight forward to determine whether this external rotation is coming from your tibia or your hip. Okay? If it's internally rotated, this would be if you walk duck-footed. This is duck-footed, this is pigeon-toed. Then again, you're just looking at the alignment of the tibia, the tibial tuberosity, to see where it's coming from. Okay, then a percussion or a compression test. A percussion test, both of them are for fractures. A percussion test is where I push your foot up and then hit you on the bottom of your heel. And I'm doing a percussion up your tibia to see if you have a fracture. A compression, especially at the ankle, if I'm worried that you fractured your ankle, I'm going to start squeezing up here. So I'm squeezing the fibula and the tibia together. And if that causes you pain down here, I would send you for x-rays because I think you may have a fracture. And then you just work your way down, unless up here really hurts them, then you don't keep going. Okay, Thompson test, if Chris was flipped over on his belly, the Thompson test would be to check for your Achilles rupture. So I'd be squeezing his Achilles if he relaxes his foot. Then if I squeeze his gastroc, it would make his foot plantar flex. And that means his Achilles is intact. If it does not plantar flex, and it's a small movement anyways, but if it doesn't plantar flex, then we think he has an Achilles rupture. Okay, Holman's sign is where you're going to push in the belly of the gastroc, like right in the middle, and you're checking for a deep vein thrombosis. So you're checking to see if they have a blood clot. It's not common in your age range, not common in athletics, but it can happen after surgery, so it's something you need to be aware of. Okay, anterior drawer we've talked about quite a bit. That is, if he relaxes his foot, I stabilize his tibia and fibula, grab his calcaneus, and pull it up. And I'm checking for the ATF ligament. If it comes forward, or I have a positive drawer, then he's sprained his anterior talofibular ligament. Next would be Taylor tilt test. So I bring his heel, I'm trying to pull his calcaneus in, and I tilt him. That's checking for his calcaneofibular ligament. Okay, so both of those are for inversion ankle sprains, when I roll my ankle in like this. The last one is called Kleiger's, and that's checking for a syndesmotic sprain or a high ankle sprain. It's the same thing. You're going to take them into full dorsiflexion and then externally rotate them. So I'm literally trying to take his talus and smash it between his tibia and fibula and open it up. If I feel a gapping or that feels painful, that's a positive Kleiger's test, and they have a high ankle sprain. So in high ankle sprains, you have your tibia, your tibiofibular ligament right here, and you have your syndesmosis, which is that little tissue between your tibia and fibula, and that can tear and separate. So you're trying to make that gap.